Oh, wonderful. You're here just on time. Why don't you take a seat? Great. Could you confirm your first and last name? Thank you. Okay. So we see that you're here for a cranial nerve. Okay, fantastic. Why don't we go ahead, and I'm going to start performing some facial exercises so we can start examining your nerves. Okay. Okay. Just need to remove my ring here. And I will need to place on some gloves. How are you? How are your holidays? Great. Mine were good as well, thank you. Alright, so first I need to get your normal measurements, okay, real quick. So if you could just look straight at me. Good. Perfect. Good, okay, and then we're gonna have to this side. Good. Good. Alright, so I just needed basic measurements for that. And I will need to measure your eyes. So again, just keep straight at me. I'm going to gently place this right here. Good. Okay. Perfect. And between your eyes. Good. Good. And this side. Good. Thank you. Alright, so we're going to go ahead first and test your eyes, okay? First I'm going to do a couple of palpating exams to see if there's any areas that are injured. Good. Okay, and I'll go ahead and use my cool light right here first. Just stare right into the distance, please. Good. Okay, if you could close this eye, please. Thank you. Good, yeah, it is kind of bright. Alright, if you could look up. Good. Alright, and to the side. Perfect. Alright, if you could cover your other eye, please. Thank you. Good. And look up now. Good. Perfect. And to that side. Good. Alright, you can put your hands down. Now, so just look right past me. Good. Good. Okay, it seems about the same reaction. Alright, we're going to test your peripherals, okay? If you could just look straight at me, I'm just going to hold up both of my hands, and whichever side you see me flicker my fingers to let me know, okay? Okay. Good. Good. You can still see that, okay? Good. really see that. Okay. Okay. No, okay. And here. Good. Okay. Now, as soon as my hands leave your peripherals, let me know now. Okay. Good. Okay. Good. Alright. So I'm going to have you take this simple eye chart test, okay? If you could just honestly read all of them back to me as far down as you can, okay? Okay, so start from the top, please. Good. 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 Great. Oh, you can't read any of these? Okay, could you go from the last letter all the way back up now? Thank you. Good. Good. D, C, F, C, X, T, P. Good. N, F, D, N, H, E. Good. Okay. Alright, we're going to go ahead and move on to testing facial features. Okay. So I'm going to first palpate your face. Okay. I need to get some different tests to see how it reacts. Alright, so I'm first going to take this nice blunt wooden compression stick, okay? And this is going to help me feel around on the different areas of your face. Good. Okay. Now I'm just going to get just a little bit closer and going to start feeling all around. Good. Feels normal. Skin is a normal, good skin color. Don't look pale. Is there a little bit of pain there? Okay. About there on your lips at all? Okay. If you could puff your cheeks out for me. Good. And pull your cheeks in. Good. Okay. Now raise your eyebrows. Good. And furrow them. Good. I'm going to keep them furrowed. I'm going to resist. Good. Good. Okay. And now if you could widen your eyes. Okay. Good. Okay, and gently close your eyes. Slowly. Good. And slowly open them. Good. And gently close them again. Good. Okay, now keep them rested. Just nice and open, rested. Okay, now I need you to tighten your eyes as tight as you can. Closed. Good. Now I'm going to try and pry your eye open. Good. Resist. 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 Good. Resist. 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 Good. Okay. So we're gonna move on, and I'm going to test each area of your face. Okay? I need you to close your eyes for me, alright? Okay. I'm going to gently press a certain area of your face for just a moment, and then release. And then I'll do that on multiple areas to see if you can feel that. Good. Right there. Can you feel all of those? How many were there, if you can remember? Okay, perfect. Okay. Great. Alright, so let's go ahead and move on. Alright, so for the next one, I am going to be testing your ears after I look in them, okay? So I'm going to take this little tool and gently look into your ear, alright? Let's see here. Perfect. Alright, that looks good. Okay, now move on to the other side. Good. Okay, this side looks really good too. Okay, so I'm going to need you to close your eyes and close this ear, alright? I'm going to repeat a couple words. I need you to repeat them back to me, okay? Okay. Marble. Good. Treasure. Okay. Gloves. Good. Games. Good. Precious. Very good. And sparkle. Good. Okay. And now can you switch your ear? Thank you. Okay. So this will be pebble. Good. Sandy. Good. Cricket. Good. Potato. Good, good. Mustache. Good. Cantaloupe. Good. And marriage. Very good. Okay, you can remove your hand. Very good. Alright, so we'll go ahead and move on. Your ears look like they are in good health. Okay. If you could just tilt your head back just slightly and open your mouth for me. Thank you. Yeah, you can keep your tongue just the way it is for now. Alright, let's go ahead and look in here. Good. Okay. Now, if you could stick your tongue out now, okay? Just going to just feel around, just slightly. Alright, and if you could say caw one more time, caw. Very good. Okay, close your mouth. Alright. Okay, so we are going to swab the inside of your mouth with a sweet or sour cotton swab or plain, okay? So I need you to just repeat back Sour, okay. Okay. Sour, okay. Sweet, okay. Sour, okay, one more. Doing great. Good. Sour again. Okay, sounds good. Seems like your taste might be a little off. If I could go ahead and take your temperature, just in case here. Alright. So I'm going to place this right under your tongue. Thank you about that. I know it's a little abrupt. Just take a moment. Good. Okay, that's great. Oh, thank goodness. Just wanted to double check on your temperature. Especially if we start seeing symptoms throughout an exam, if there's anything that could be more alarming. Alright. Okay, so we're going to go ahead and move on to your nose and your scent. Okay, this nerve will be very, very good to have in working condition, as we always need our nose. Okay, good. Have you ever had any problems with your smell or any trauma to your nose or airway? No, okay. Well, I have some scented markers here, and I am going to present each one to you, and you tell me back which one you can smell. Okay. Alright, so what is this one right here? Pine. Okay. And this one. Lemon. Good. This one. Lavender. Good. This one. Chocolate. Good. This one. Grape. Okay. Yeah, this one. Vanilla. Okay, perfect. Alright. So I'm going to need you to relax for me and take a breath, okay? I'm going to put some pressure on your shoulders, okay, as you raise them up. I'm going to be pushing down, okay, to see how even your muscles are working, okay? So I'm just going to place my hands right here. If you could start lifting, good. Try and apply some uneven pressure as well. Okay, good. Alright, and relax. Good. And I'm going to just Alright, I'm gonna have you push against my hands. Good. Keep resisting. Good. Alright, and we'll turn the other way. Alright, and start resisting, trying to push this way. Good. 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 Okay, relax. Relax now. Okay. Good. Okay, so I'm going to need you to hold this ring in first this hand. Good. Alright. Now I need you to just tightly squeeze it. Good. Do you feel like there's any loss of strength in that hand at all? No? Okay, so let's go ahead and switch to the other one. Okay. Good. Good. It's stronger. Okay, perfect. Alright. I'm assuming that is your dominant hand. Okay, perfect. Okay. So then next I'm going to just look at your hands and your fingers, okay? Okay. I need to check to see how the cuticles are forming, if there are any ridges or bumps on your fingernails, or if there's any tenderness or possible arthritis forming, okay? Good. Alright, and the other hand. There's no tenderness. Okay. Alright, that hand looks good too. Alright, and just keep your arms to the side. I am going to run this down the side of your arm. You can feel that all the way down. Okay, good. Good, alright, and the other side. You can still feel that? Alright, on this side. Good, alright. Alright, so we're going to move on to the last portion of this cranial nerve examination, okay? It's going to be a memory test, alright? We will do a series of words and then a series of numbers. It will not exceed 6 of each, okay? So we'll first do the numbers, alright? Let me just remove my gloves. Okay, so let me go ahead and write out okay, so the first set of numbers that I'll need you to remember is 1, 7, 8, 3, 5, 7. Could you repeat any of those back to me? It doesn't matter which order. 2 7s, good. Okay. Okay, that is perfectly fine. Alright, we're going to move on to your set of words now. Okay, so go ahead and I will have you repeat these in no special order as well. Okay, so it'll be little, moon, rely, metal, foot, horse. Could you repeat any of those back to me? Horse, good. Okay. Good. Alright. Okay. Okay, sounds good. Now what I need you to do is try to recall those 6 numbers that I repeated to you earlier. Could you do that for me? Good. 7. Okay. 3. 1. I can't remember the others. Okay. That's perfectly fine. That's very, very good. Okay. Let me just... Good. Okay. Alright, so that is all that I have for you today. Okay, you are a great patient. Everything looks like it is all in working order. I hope that you enjoyed this examination and that it caused you some relaxation. And we also have you in our records now. Yes. So you have a wonderful day and we will see you next time, okay? Great. Okay. Bye-bye.